The first sign that something was wrong was that my stool was almost too large to pass and it was hard to still. Like even if I didn't have dairy and I had like normal sized stools, it's still quite a bit of pain. Like early symptoms, like I've always been on the constipated side, like even as I was growing up. A dry spot on my scalp that would like peel and come back. And then blood tests were pretty much always anemic, like something was off with my blood. Those levels were too low. So I think those were like the earliest symptoms. Hey everyone, welcome to Chela Cheetah. My name is Nia. Today I'm going to be talking about my diagnosis with Crohn's disease, some symptoms that I experienced, some different things I tried along the way, and my recent remission. The first sign that something was wrong was that my stool was almost too large to pass and it was hard to still. Like from searching online, I found a blog where someone's child was experiencing the same type of issues and they found that it was lactose intolerance. So I just figured that that's what I was going through because it would get worse. I would experience that specific problem like after I had dairy. I was already vegetarian and had been for like 3 or 4 years at the time. I also experimented with being raw vegan. So I would go back and forth between vegetarian and raw vegan. Seeing that dairy was causing such an issue, I removed that and just became a regular vegan. So this was back in 2014. And it was around that time when I first started seeking medical help for whatever was going on. Like even if I didn't have dairy and I had like normal sized stools, it's still quite a bit of pain. So thinking about back to like early symptoms, like I've always been on the constipated side, like even as I was growing up. I did notice a dry spot on my scalp that would like peel and come back. And then blood tests were pretty much always anemic, like something was off with my blood. Those levels were too low. So I think those were like the earliest symptoms. So back in 2014, I went to a naturopathic doctor who tested for food allergies. I mean, me being into like vegetarian and raw vegan, like I really wanted to do things as like natural as possible, I guess. And it showed that the testing that she did showed that I had sensitivity to dairy as well as corn. And I had another test that showed I had high cortisol levels. So this doctor was really focused on lowering stress and healing my gut, strengthening my immune system as a whole. And she wanted to prevent me from removing any more foods from my diet. She told me that if I continued taking out problematic food, I would just increasingly become more sensitive to more and more foods. I ended up working with her for just a short time, 3 or 4 months, and that's only because my employer at the time changed insurance providers and the new one didn't cover that anymore. Next, I went to the Mayo Clinic. They had me scheduled for quite a few tests because they're quite thorough. I stopped after the 3rd test. I remember doing like a bariatric type of test where I had to drink like this white fluid, and then they like watch me through a machine, like actually go to the restroom. And there was another test where, and I don't remember the name of the test, this was a while ago, but they put something inside of me and then like blew it up a little bit, kind of like a balloon. But from all of those tests so far, I ended up being diagnosed with a rectocell. And I also met with a dietitian, and she gave me a packet of information, and she told me that maybe it's just my body, and it's maybe just my normal to go 2 or 3 times a week, and that I wasn't necessarily constipated just because I wasn't having a bowel movement every day. So I started thinking, maybe it wasn't that serious, and I stopped after the 3rd test. They had me scheduled for at least a sigmoidoscopy, something like that. They might have even had me scheduled for a colonoscopy. Like the more invasive tests were scheduled later. But like I said, I stopped there, and I was thinking maybe I just wasn't drinking enough water or eating enough, or maybe I needed to do a cleanse. Maybe there was something that I could do on my end to alleviate symptoms. And definitely I was the type of person to like go all day without eating and not realize it. Like I was pretty out of touch with my body back then. I lived in my head a lot. So food was pretty like secondary. So I kept up with the vegan diet, and I just dreaded when it was time to go to the restroom. I got to the point where I could not go to the restroom without an enema. How I found that out is it was going on like 2 weeks, and I hadn't had any bowel movement. So at that point, I started adding ghee to my food, or even just taking a shot of it alone. And that came from speaking to an Ayurvedic practitioner at my church. We volunteered together. She shared with me that she had gone through the same type of thing when she was vegan and found that that type of diet was just too drying. She's actually from India and didn't grow up and believe in Ayurveda until it helped her parents. And I was willing to try it because it's just not good to go so long without eliminating waste regularly. I ended up getting into Zumba. I became a certified instructor, started teaching classes in my area, and I would get very bad pain in my hips and back to the point where I can barely move. Like sometimes it would definitely be like the sciatic nerve that was activated. And I started taking Advil just to make it through my classes. I was paying attention to what I ate even more, and the pain seemed to be coming from happening after any time I ate like any wheat or gluten products. And it never failed that I would experience that pain for a few days, and it would gradually go away in a couple weeks. I remember going to urgent care with the worst pain in like the middle of my chest, like around my diaphragm. I ended up having acid reflux and an ulcer. So the ER doctor attributed it to the Advil, so I stopped taking as many. So I think the limit is like 6 a day, so now I'm having like 2 to 4 a day if I need it. And so that was my normal. That was my normal for a couple of years due to the inflammation that I had going on. And things really came to a head when it felt like my bones were about to burst from the inside. It was like pressure coming from inside of my bones. Like I could touch my arm or my leg or wherever that pain was coming from, and it wouldn't make a difference. Like it was very much coming from the inside. I was under extreme stress and grieving at the time due to losing a parent. At that time, I went to a hematologist. He recommended I added back at least eggs and dairy to my diet. And shortly thereafter, I had my first colonoscopy, and I was diagnosed with Crohn's colitis, and it was mild. So that was back in 2019. And thinking back, like I did have to be a little bit assertive in getting that colonoscopy. I was under 40 at the time, and they really were just like, you don't really need one, or why. At that point, like I would go to the restroom and there would be like blood in the toilet. So I stressed that to them, and I was granted that colonoscopy. So I really wanted to throw that in there to let you know that if you're having something going on, and like don't dismiss it. And you may have to push back a little bit with the doctors. Just advocate for yourself. So I got my diagnosis with Crohn's colitis in late 2019. It was probably in October or November when I had my test. And so my doctor's appointment, my follow-up appointment, and then also to like come up with the treatment plan, that was at the beginning of 2020, like in January or February. And by that time, the pandemic had started. The gastroenterologist recommended basaloside plus steroids, and I did not feel comfortable taking the steroids since it would lower my immunity. And that's kind of the point of the steroids, to allow the medication to work, to like bring your body's basically attacking itself, and the steroids like suppress that. And I remember asking the doctor, like, do you really think it's a good idea, like with this mystery virus spreading rapidly, people are dying, there's no cure, there's no vaccine? And he agreed. So I only took the basaloside, and I took 3 pills a day, 3 times a day, so 9 pills daily. And I was on those for about 6 months. I had my CRP levels tested, and they were normal. I also didn't have any like symptoms of pain or like severe constipation. Like for me, that's all that mattered. But the doctor very much wanted to do another colonoscopy to make sure the inflammation wasn't still active. So I had my next one in 2021. And I remember having to get tested for COVID prior to the procedure. Like I drove up outside the hospital and someone came out and swabbed the inside of my nose. And so that colonoscopy revealed that I still had Crohn's active. So I was in clinical remission, I believe is what they call it, because my blood work looked good, but I was not in endoscopic remission. On the plus side, it was still considered mild, and they didn't really expect it to like progress or anything like that. And my doctor was okay with me staying on Bazalazide, but also stressed that it really wasn't enough because it is supposed to be paired with those steroids. And so that's where they first mentioned biologics, and they wanted me to go on one, Entyvio in particular. And this is when I am like doubting my diagnosis. I'm like, well, could it be something else? Because excuse me, Crohn's, colitis, there's Crohn's disease, which is IBD, and then there's ulcerative colitis, which is IBD as well, but there's also colitis that can just be IBS, and IBD and IBS are so different. And then also when you get colonoscopies, they do give you pictures of what you look like inside, and I felt like they were telling me it's mild, and I'm looking at the pictures and they look like normal tissue to me. Not that I have a doctor's eyes, but it just didn't look bad to me. And so I felt like that was too extreme to be going on a biologic, so I did decline. I went to follow up with them a few times, and you know, they kept bringing up the biologic and really wanted me to go on that. And so ultimately I went to another gastroenterologist because I didn't want to do the biologic. That doctor prescribed me mesalamine only because my insurance, there was some type of issue with the insurance and Bazalazide at the time. So I remember picking up my prescription for the mesalamine. So I have this huge bag in the cabinet with like all these pills, and I remember getting a call from that doctor's office telling me that they were able to get the Bazalazide to go through with my insurance and everything, and so now I'm back on Bazalazide. I never ended up taking the mesalamine. All right, so then I start going to a naturopathic doctor, and I was doing the Bazalazide as well as the supplements that the naturopath prescribed me. And one of them I remember was Mimosa Supreme. There were a few others. It's been a bit. I don't remember the rest of them, but either way, I'm still feeling fine. I don't have pain going to the restroom or anything like that. And so now we are in 2023. At some point in going to this naturopathic doctor, I did stop taking Bazalazide. There were so many like supplements to take. I thought, well, I feel okay, so I went off of them. From what I've read about Crohn's disease, like you're not supposed to go by like how you feel, because like your body could just be totally attacking and eating itself up basically. So, but I did not know that at the time. And so I ended up being off prescription medications for about a year. Like nothing in particular happened, but it's like a point where I was like in limbo because I don't have a gastro doctor anymore. I'm not going to the naturopathic doctor anymore. They went up really high with their rates and it was unexpected. So I stopped going to them. So I didn't know my CRP levels and I hadn't had a stool test in a while. So I go back to the Mayo Clinic and I had my first colonoscopy with them. So now that's my third colonoscopy ever. And they found that my Crohn's disease was moderate to severe with ulcerations. And I could kind of tell really because, I mean, no, I didn't have pain, but like as I would eat food, there would be some discomfort sometime, not always, but it was almost as if the food was passing by those spots in my stomach. Like I could feel that. And then also I can see it on the pictures, like it looked like something was nibbling on my insides. So by this time I had met others on biologics and I felt more positive about them. So this doctor recommended that I go on Skyrizi, which was a new option for me. Even when the first gastro doctor was talking about biologics, Skyrizi wasn't on there, which it is relatively new for CD. And Skyrizi, good thing about it is that it targets the gut rather than the whole body, so there's not much of a negative impact, if any at all, on the immune system. So I started that treatment in May of last year, 2024. The first 3 infusions were at the clinic, and then every 2 months I administer my own dose at home. And my CRP levels and calprotectin levels, like from the stool test, they were still elevated even going into May of this year. When I had my last colonoscopy as well, that was just like 2 or 3 weeks ago that I had my 4th colonoscopy. But the great news is that I got a remission result. Like, I don't have the active inflammation going on. And not to get too far off topic, but I did do a 3-day water fast the day before my procedure, and I felt like that helped me get to remission. Because like I said, those CRP and those calprotectin levels, the stool test levels were still elevated. So I mean, it could have been all of Skyrizi, but I just wanted to throw that in there, especially like if you're open to something like that. Quite a lot of healing can be done with water fasts if they're done properly, and if they're broken properly, that you won't have any issues. I started using the Simple app maybe like a couple months prior to the colonoscopy. It had nothing to do with me having the colonoscopy though. I just really was just trying to make healthier changes, and so I was already in like a pattern of doing intermittent fasting. And then after I got into that pretty well, I read Fasting Like a Girl to kind of tweak my practice. So that's how I ended up being sold on doing a 3-day water fast. Thank you so much for listening to me share my story. Listening to other people's stories have helped me so much, and I definitely wanted to share my story in case it helps someone else. If you're on a healing journey, I'd love to hear about it in the comments, particularly if you have an autoimmune condition or you also have Crohn's disease, or if you have any questions for me, just drop it below. Thanks.